In this video by deck plate we will be discussing sinusitis and rhinitis conditions. Some of the most common sinusitis and rhinitis conditions experienced by military personnel. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. Sinusitis and rhinitis conditions veterans may suffer during military service. Veterans with rhinitis and sinusitis may be eligible for VA disability benefits based on their symptoms and medical evidence linking their condition to environmental hazards. Here are some sinusitis and rhinitis conditions veterans may suffer during military service. Chronic sinusitis. Chronic sinusitis is a condition that affects a person's sinuses, becoming inflamed and swollen for 3 months or longer, despite seeking and undergoing treatment. Causes of chronic sinusitis. The cause of chronic sinusitis usually is not known. Some medical conditions, including cystic fibrosis, can cause chronic sinusitis in children and teens. Some conditions can make chronic sinusitis worse. These include a common cold or other infection that affects the sinuses. Viruses or bacteria can cause these infections. A problem inside the nose, such as a deviated nasal septum, nasal polyps or tumors. Long-term effects of chronic sinusitis. Serious complications of chronic sinusitis are rare. They can include vision problems. If a sinus infection spreads to an eye socket, it can reduce vision or possibly cause blindness. Infections. It's not common, but a serious sinus infection can spread to the membranes and fluid around the brain and spinal cord. The infection is called meningitis. Other serious infections can spread to the bones, called osteomyelitis, or to skin, called cellulitis. Diagnosis of chronic sinusitis. A healthcare provider might ask about symptoms and do an exam. The exam might include feeling for tenderness in the nose and face and looking inside the nose. Other ways to diagnose chronic sinusitis and rule out other conditions include nasal endoscopy. A healthcare provider inserts a thin, flexible tube, known as an endoscope, into the nose. A light on the tube allows a care provider to see inside the sinuses. Imaging tests. CT or MRI scans can show details of the sinuses and nasal area. These images might pinpoint the cause of chronic sinusitis. Nasal and sinus samples. Lab tests aren't often used to diagnose chronic sinusitis. But, if the condition doesn't get better with treatment or gets worse, tissue samples from the nose or sinuses might help find the cause. An allergy test. If allergies might be causing chronic sinusitis, an allergy skin test might show the cause. Allergic rhinitis. Allergic rhinitis, hay fever, is an allergic reaction to tiny particles in the air called allergens. When you breathe in allergens through your nose or mouth, your body reacts by releasing a natural chemical called histamine. Despite being called hay fever, hay doesn't cause hay fever and most people don't get a fever. Causes of allergic rhinitis. When you have hay fever, your immune system identifies a harmless airborne substance as being harmful. This substance is called an allergen. Your immune system is how your body protects itself, so it produces immunoglobulin E IgE antibodies to protect against this allergen. The next time you come in contact with the allergen, these antibodies signal your immune system to release chemicals such as histamine into your bloodstream. This causes a reaction that leads to the symptoms of hay fever. Long-term effects of allergic rhinitis. Problems that may go along with hay fever include reduced quality of life. Hay fever can interfere with your enjoyment of activities and cause you to be less productive. For many people, hay fever symptoms lead to missing work or school. Poor sleep. Hay fever symptoms can keep you awake or make it hard to stay asleep. This can lead to fatigue and a general feeling of being unwell. Malaise. Worsening asthma. Hay fever can worsen symptoms of asthma, such as coughing and wheezing. Sinusitis. Prolonged sinus congestion due to hay fever may increase your risk of getting sinusitis, an infection or inflammation of the membrane that lines the sinuses. Ear infection. In children, hay fever often is a factor in middle ear infection. Otitis media. Diagnosis of allergic rhinitis. To diagnose hay fever, your healthcare provider typically does a physical exam and talks about your health, symptoms and possible triggers. Your provider may recommend one or both of these tests. Skin prick test. Small amounts of material that can trigger allergies are pricked into patches of skin on your arm or upper back. You're then watched for an allergic reaction. If you're allergic, you develop a raised bump, hive, at the site of that allergen. This typically takes about 15 to 20 minutes. Allergy specialists usually are best equipped to perform allergy skin tests. Allergy blood test. A blood sample is sent to a lab to measure your immune system's response to a specific allergen. This test measures the amount of allergy-causing antibodies in your bloodstream, known as immunoglobulin E, IgE, antibodies. Non-allergic rhinitis. Non-allergic rhinitis involves sneezing or a stuffy, drippy nose. It can be a long-term problem, and it has no clear cause. The symptoms are like those of hay fever, also called allergic rhinitis, But non-allergic rhinitis isn't caused by allergies. Causes of non-allergic rhinitis. The exact cause of non-allergic rhinitis is unknown. But experts do know that non-allergic rhinitis happens when blood vessels in the nose expand. These blood vessels fill the tissue that lines the inside of the nose. Many things could cause this. For instance, the nerve endings in the nose might react to triggers too easily. But any cause brings on the same result: swelling inside the nose, congestion, or lots of mucus. Triggers of non-allergic rhinitis can include irritants in the air. These include dust, smog, and cigarette smoke. Strong odors such as perfumes also can cause the symptoms to start. So can chemical fumes, including fumes some workers might get exposed to at their jobs. Weather, changes in temperature or humidity can trigger swelling in the lining of the nose. This can cause a runny or stuffy nose. Infections, illnesses caused by a virus often cause non-allergic rhinitis. These include a cold or the flu. Foods and drinks. Non-allergic rhinitis can happen when you eat hot or spicy foods, are the main triggers. Drinking alcohol also can cause the tissue that lines the inside of the nose to swell. This can lead to a stuffy nose. Some medicines, these include aspirin and ibuprofen, Advil, Motrin IB, others. High blood pressure medicines such as beta blockers also can cause symptoms. Medicines that have a calming effect, called sedatives, can trigger non-allergic rhinitis too. So can medicines for depression. Birth control pills and medicines that treat erectile dysfunction also can trigger the symptoms. And using decongestant nose spray or drops too often can cause a type of non-allergic rhinitis called rhinitis medicamentosa. Hormone changes. These can be due to pregnancy, periods, or birth control use. Hormone problems that may trigger non-allergic rhinitis include a condition that happens when the thyroid gland doesn't make enough thyroid hormone. This is called hypothyroidism. Issues linked with sleep. Lying on your back while you sleep can trigger non-allergic rhinitis. Acid reflux that happens overnight also can be a trigger. Long-term effects of non-allergic rhinitis. Non-allergic rhinitis might be linked to nasal polyps. These are soft growths that form on the tissue that lines the inside of the nose. Polyps also can form on the lining of the spaces inside the nose and head, called sinuses. Polyps are caused by swelling, also known as inflammation. They're not cancer. Small polyps might not cause problems, but larger ones can block the airflow through the nose. That makes it hard to breathe. Sinusitis. This is swelling of the sinuses. Long-term congestion in the nose due to non-allergic rhinitis can raise the risk of sinusitis. Trouble with daily life. Non-allergic rhinitis might affect your work or school grades. You also might need to take time off when your symptoms flare or when you need a checkup. Diagnosis of non-allergic rhinitis. Your healthcare provider will likely give you a physical exam and ask you about your symptoms. You'll need tests to find out if something other than non-allergic rhinitis is causing your symptoms. You may have non-allergic rhinitis if you have a stuffy nose, your nose runs, or mucus drips down the back of your throat. Tests for other health problems don't find causes such as allergies or a sinus problem. In some cases, your provider might have you try a medicine to see whether your symptoms get better. Checking for allergies. Allergies often cause symptoms such as sneezing and a stuffy, runny nose. Some tests can help make sure that your symptoms aren't caused by an allergy. You may need skin or blood tests. Skin test. The skin is pricked and exposed to tiny bits of common allergens found in the air. These include dust mites, mold, pollen, and cat and dog dander. If you're allergic to any of these, you'll likely get a raised bump where your skin was pricked. If you're not allergic, your skin won't have changes. Blood test. A lab can test a sample of your blood to find out if you have an allergy. The lab checks for higher levels of proteins called immunoglobulin E antibodies. These can release chemicals that cause allergy symptoms. Sometimes, symptoms may be caused by both allergic and non-allergic triggers. Checking for sinus problems. Your provider also will want to find out if your symptoms are due to a sinus problem. You might need an imaging test to check your sinuses. Nasal endoscopy. This test checks the sinuses with a thin tool that has a camera on the end. The tool is called an endoscope. The endoscope is passed through the nostrils to look inside the nose. Computed tomography CT scan. This test uses X-rays to make images of the sinuses. The images are more detailed than those made by typical X-ray exams. Chronic laryngitis. Laryngitis is an inflammation of the larynx, the voice box that contains the vocal cords in the upper portion of the neck. Laryngitis occurs in two forms, acute and chronic. Acute laryngitis typically is a brief illness producing hoarseness and a sore throat. In most cases, an upper respiratory tract infection causes it. Chronic laryngitis is a more persistent disorder that produces lingering hoarseness and other voice changes. It usually is painless and has no significant sign of infection. Causes of chronic laryngitis. Laryngitis that lasts longer than 3 weeks is known as chronic laryngitis. This type of laryngitis is generally caused by exposure to irritants over time. Chronic laryngitis can cause vocal cord strain and injuries or growths on the vocal cords, polyps or nodules. Chronic laryngitis can be caused by inhaled irritants, such as chemical fumes, allergens or smoke. Acid reflux. also called gastroesophageal reflux disease, GERD, chronic sinusitis, excessive alcohol use, habitual overuse of your voice, such as in singers or cheerleaders, smoking. Less common causes of chronic laryngitis include bacterial or fungal infections, infections with certain parasites. Other causes of chronic hoarseness include cancer, vocal cord paralysis, which can result from nerve injury due to surgery, injury to the chest or neck, cancer, nerve disorders, or other health conditions. Bowing of the vocal cords. Long-term effects of chronic laryngitis. In some cases of laryngitis caused by infection, the infection may spread to other parts of the respiratory tract. Diagnosis of chronic laryngitis. The most common sign of laryngitis is hoarseness. Changes in your voice can vary with the degree of infection or irritation, ranging from mild hoarseness to almost total loss of your voice. If you have chronic hoarseness, your doctor may review your medical history and symptoms. He or she may want to listen to your voice and examine your vocal cords, and he or she may refer you to an ear, nose and throat specialist. These techniques sometimes are used to help diagnose laryngitis. Laryngoscopy. In a procedure called laryngoscopy, your doctor can visually examine your vocal cords by using a light and a tiny mirror to look into the back of your throat. Or your doctor may use fiber optic laryngoscopy. This involves inserting a thin, flexible tube, endoscope, with a tiny camera and light through your nose or mouth and into the back of your throat. Then your doctor can watch the motion of your vocal cords as you speak. Biopsy. If your doctor sees a suspicious area, he or she may do a biopsy, taking a sample of tissue for examination under a microscope. Deviated nasal septum. A deviated septum is when the bone and cartilage that divides your nasal cavity is off-center. Your nasal septum separates the right and left sides of your nasal cavity. It's why you have two nostrils. Causes of deviated nasal septum. A deviated septum occurs when your nasal septum, the thin wall that separates your right and left nasal passages, is displaced to one side. A deviated septum can be caused by a condition present at birth. In some cases, a deviated septum occurs when the fetus develops in the womb and is apparent at birth. Injury to the nose. A deviated septum can also be the result of an injury that causes the nasal septum to be moved out of position. In infants, such an injury may occur during childbirth. In children and adults, a wide array of accidents may lead to a nose injury and deviated septum. Trauma to the nose most commonly occurs during contact sports, rough play such as wrestling or automobile accidents. The aging process may affect nasal structures, worsening a deviated septum over time. Swelling and irritation of the nasal cavities or sinus cavities because of an infection can further narrow the nasal passage and result in nasal obstruction. Long-term effects of deviated nasal septum. A severely deviated septum causing nasal blockage can lead to dry mouth, due to chronic mouth breathing, a feeling of pressure or congestion in your nasal passages. Disturbed sleep, due to the unpleasantness of not being able to breathe comfortably through your nose at night. Diagnosis of deviated nasal septum. During your visit, your doctor will first ask about any symptoms you may have. To examine the inside of your nose, the doctor will use a bright light and sometimes an instrument designed to spread open your nostrils. Sometimes the doctor will check farther back in your nose with a long tube-shaped scope with a bright light at the tip. The doctor may also look at your nasal tissues before and after applying a decongestant spray. Based on this exam, he or she can diagnose a deviated septum and determine the seriousness of your condition. If your doctor is not an ear, nose and throat specialist and you need treatment, he or she may refer you to a specialist for further consultation and treatment. If you were discharged veteran from U.S. military and looking for the compensation you can get for the sinusitis and rhinitis conditions, please check out our other video on sinusitis and rhinitis conditions with compensation rating. Thank you for watching our video. Please don't forget to subscribe and like our videos.